All right, we'll go ahead and get started. Thank you all so much for joining us today. My name is Jill Christian, and I am with the Office of Community Outreach and Engagement at Huntsman Cancer Institute. Allison Faust is traveling, so I will be filling in for her today as facilitator, and I'm really excited to be with you all. My background includes extensive work with community health workers in Utah, particularly in supporting training capacity building, and community partnerships to improve health equity. So I look forward to today's discussion and appreciate you all being here. Next slide. Here's the agenda for today. I will begin with setting the stage and giving a brief community health worker overview. We will then have the pleasure of hearing from Kamali Tripp Harris, Areta Tupula, and Beth Ann Carter, and then we will leave some time for a question and comment period at the end. Next slide. So I just want to set the stage briefly for anyone who is attending this webinar series for the first time. I'll start by sharing the mission of Huntsman Cancer Institute, which is to understand cancer from its beginnings, to use that knowledge in the creation and improvement of cancer treatments, to relieve the suffering of cancer patients, and to provide education about cancer risk prevention and care. Thanks, Gabby. In 2021, Huntsman Cancer Institute formalized our commitment to the five-state Mountain West and expanded our catchment area to include Idaho, Montana, Nevada, Utah, and Wyoming. And we refer to this as the area we serve. Next slide. Here's our community outreach and engagement team. Our office is the convener of the Mountain West Cancer Collaborative, which is a network comprised of cancer patients, survivors, caregivers, and community, public health, and health systems professionals working and or living in Idaho, Montana, Nevada, Utah, and Wyoming. You can see some of our activities there on the slide, and you can feel free to reach out to us for more information or if you have any questions. Next slide. So just briefly, what the Mountain West Cancer Collaborative is a space to foster bidirectional learning, resource sharing, and mutually beneficial relationship building across state lines and within tribal communities. It's also a newsletter, a series of webinars and networking opportunities, and a medium to highlight the impactful work being led by state, regional, and tribal partners. It is not a formal coalition, a decision-making body, or an official membership. Next slide. And if you have not already joined the collaborative and if you are interested, you can scan the QR code on the slide. Next slide. And so now just to get into some of our content today, the objectives for this webinar are to highlight the role of CHWs in cancer prevention, education, and support, to share strategies for effective CHW-led cancer education initiatives, and to explore success stories and lessons learned from CHW programs. Next slide. So I'd like to start with just some of the basics about community health workers, which I will refer to as CHWs from here on out. They sometimes go by other titles such as promotora, health navigators, community health representatives, and there's many more. But regardless of what title they go by, what makes this profession unique is that they are trusted members of their communities who bridge the gap between healthcare systems and the communities they serve. CHWs operate in a variety of settings, including healthcare facilities, community organizations, and government programs. You can see some of their key responsibilities there on the slide, and we will dive a little more into these throughout the webinar. But overall, CHWs, they play a vital role in improving access to care, in fostering trust, and promoting health literacy. Their work strengthens public health systems by ensuring interventions are community-driven and culturally relevant. And when talking about cancer specifically, CHWs can support individuals across the continuum, from prevention to survivorship, helping to reduce cancer disparities and improve health outcomes, particularly for under-resourced communities. Next slide. So now I'll just briefly highlight a few examples of how CHWs contribute at each stage of the cancer continuum. While this isn't an exhaustive list, it will give you an idea of the valuable role of CHWs in each stage of the continuum. So the CHW role in cancer prevention includes things like educating communities about cancer risk factors, as well as vaccinations for cancer prevention, and addressing cultural and social barriers that impact health behaviors. Next slide. In early detection, CHWs can educate about the importance of regular screenings. They can assist with navigating the healthcare system, encourage follow-ups and screening completion, and address misconceptions and fears about cancer screenings through culturally appropriate education. Next slide. And when dealing with a cancer diagnosis, a CHW can help patients and families understand their diagnosis and treatment options in simple terms. They can provide emotional support and guidance and connect patients with resources such as financial assistance and mental health support. Next slide. During treatment, CHWs can assist patients with things like helping them navigate treatment logistics. They can help educate about treatment side effects and how to manage them, and also assist with care coordination. Next slide. Some examples in survivorship include connecting survivors with support groups and mental health resources, assisting in navigating employment, insurance, and financial challenges post-treatment, and encouraging adherence to care plans and screenings. Next slide. And then in end-of-life and palliative care, CHWs can provide emotional and spiritual support. They can advocate for culturally appropriate end-of-life discussions and provide support through grief and bereavement services. Next slide. So to conclude my section, I'd just like to highlight a few key opportunities for the future of CHWs in cancer education and care. The first is the opportunity for CHWs to enhance patient navigation by assisting individuals with resource navigation prior to a diagnosis, also working with populations not covered by patient navigation services, and working in collaboration with patient navigators to fill any gaps and ensure a seamless support system. The next is by leveraging mobile and telehealth solutions. CHWs can connect patients to and help them access tele-oncology services and mobile screening programs that can help to reduce travel burdens and increase early detection. Also, recognizing CHWs as essential member of care teams can enhance patient support, survivorship care, and access to mental health resources. Building on this, another opportunity is training CHWs to conduct outreach for patients with advanced cancer, training them to help with symptom management and ultimately reducing hospitalizations. And then lastly, CHWs can play a key role in increasing clinical trial participation in underserved communities by building trust, addressing concerns, and providing culturally relevant education about the benefits and opportunities of clinical research. Next slide. All right, so I've heard enough of myself talk, so I'm delighted to introduce our next presenters, Kamali Tripp-Harris and Areta Tupola. I'm just going to read some of their bios so you get a better understanding of their backgrounds and their area of expertise. Kamali Tripp-Harris is the CHW Program Manager at the University of Utah School of Medicine's Office of Academic Culture and Community, leading a diverse CHW team and integrating CHWs into medical education and student-led clinics. She previously supported Utah's health equity teams and community engagement and serves on the board of directors for the Utah Community Health Workers Association. With 18 years of experience in mental and behavioral health care, she also co-hosts the Island Wave podcast that celebrates Utah's Pacific Islander community. With expertise in education, healthcare, and cultural advocacy, Kamali's work bridges communities and supports equity, mentorship, and collaboration in every role she undertakes. Next, we have Areta Tupola. Born and raised in Lae, Hawaii, Areta has over 25 years of experience in community outreach, advocacy, and health promotion. Since 2016, she has served as director of the Utah Community Health Worker Association. With a bachelor's degree in social work from BYU Hawaii and a master's in social work from the University of Hawaii at Manoa, she focuses on capacity building and addressing social determinants of health through culturally relevant practices. She also works as a community health coordinator at the University of Utah and co-hosts the Island Way podcast. So I will go ahead and turn the time over.
Thank you, Jill, and thank you for the opportunity to be here. Next slide, please, Gabby. Thank you. So we want to share with you a little bit more about our workforce. We hope to have a discussion with you about how familiar you are with community health workers, the work they might be doing for you. And then we will share a little bit of what we're doing in our workforce to support cancer prevention and treatment and the patients and communities that we serve, and providing tailored interventions to meet them where they're at and improve health outcomes. I just wanted to share that these images represent a meaningful community engagement. As Jill said, I oversee a team of community health workers that are embedded in our MD program and our student-led clinics. And we're teaching them our scope and skills, how to engage the community in this meaningful community engagement, how to build trust and provide longitudinal care, and how to understand the barriers that they face and the needs that they have, and then formulating those resources and one-stop shopping at our clinics. Next slide, please, Gabby. Thank you so much. And so Oretta and I would love to have this group discussion with you. Who are community health workers? Does anyone care to share a definition you have or the understanding you have or experience? I see my good friend Kim from Health Choice Utah, who is a community health worker. Kathy Wolfsfeld, another community health worker. I'd love for you folks to come off of mute and share your insights. Or Oretta.
You know, I'm here for both of you because you guys are amazing community health workers. And I love the way Oretta explains it. It's just so heartfelt, and I am here for it. So go for it, Oretta. It's all yours.
Kathy, did you want to share something?
Thank you.
Please introduce yourself.
In my role as a community health worker, I represent the African American community in the Salt Lake Valley. And I do not work through a clinic. I work through a church. So that's a different aspect of community health work. I facilitate diabetes prevention classes and health fairs and any kind of education that I can give the public, the community, on wellness, whether it be mental health or sickle cell awareness. And then we provide resources for the people in our community for whatever they want to do. For if they have domestic abuse issues, then we will have a resource. If they need mental health, then we have someone that looks like them to recommend for them to see. So things like that I do to help my community. Thank you.
Thanks, Kathy.
Thank you, Kathy.
So for me, community health workers are community members who are representing the communities that they serve, not just their ethnicity, but their lived experience through whether it was cancer or diabetes or, you know, just needing help through navigating systems. I served as a community health worker, cancer navigator in Hawaii for the Imihale Cancer Project. And we helped patients, like Jill explained, throughout the whole spectrum of cancer care from beginning till end. And so the main thing I think I would just share about how we define a CHW is really people who represent that community, but also have lived experiences in that community. We do get a lot of training in specific areas for the work that we do, like patient navigation, but what makes our work effective is the lived experience of understanding how to navigate these systems. The health systems are so hard to navigate, and whether it's insurance or care coordination or patient just navigating through their emotional feelings of the diagnosis. And so I think that's the piece that really helps us to fill the gaps of services when we are taking care of our patients, because there are roles of that overlap, like social workers or case managers. We really are an extension of their roles out into community, because most of it is inpatient, right? And so when the patient leaves the hospital, we're able to help them outside, support them through making a phone call to make their next appointment or to see an oncologist or all of those things. And so it's that extension of care, I think, that really makes the work that we do effective, and the representation that we have of being part of that community and understanding what they're going through.
Thank you, Areta. And you may hear the term people falling through the cracks or falling off a cliff. This community health workers are the safety net to keep folks in the healthcare system and continuing their therapies. I think you're going to advance a couple of times, Gabby, on the slide. Perfect. Thank you. So the points here are community health workers are from the communities you will serve. So they have great insights. They can share their connection and trust that they've built, and they are chosen leaders and can provide cultural and linguistic information for you when you're adapting your programs, and they can advocate for patients and addressing their social determinants of health, helping them to find those community resources that are available. We provide health education and outreach, so train the trainer models are perfect for our workforce. If you have something you'd like to disseminate to our community, teach the community health worker and empower them to teach their communities. Those models work really well for us. We can promote prevention, screenings, early detection, and assist in managing chronic conditions. And what that looks like is visiting people in their home, helping them go through their pantries to understand what foods to avoid and which ones are best. Maybe they need help remembering the medications they take, so having pill minders or writing things down on a daily planner might be something that we do. We also, as we said, connect with resources and support networks, but we also help them set realistic goals to accomplish the tasks that have been set forth with their providers. Next slide. Oh, there we go. And so this is a video, Gabby, I hope that you're able to share. Thank you so much. I think we need to reshare for sound. Thank you. It's so great to see everyone. I love the turnout today. And I know that you're coming from all over the Mountain West, so thank you so much for being here with us and sharing space. Thank you, Gabby. Thank you, Lynette. Oh, it's so great to see you here today. Thank you.
Gabby, do you want me to try sharing the video? The screen is just black right now.
So while they're working on that, I'll share with you that this was a project for qualitative research on the ROI for our workforce that was done by Karishma Shah, and she is one of our MD PhD students up at the University of Utah. So there were two components here. I actually helped conduct the focus groups for the data collection, and then this video is a little bit of a voice diary for everyone to see. Oh, hi, Jenny. Another community health worker has joined us. Thank you so much for being here. She is our clinical community health worker for the Midvale CBC. Thank you.
A community health worker is someone from a community that they are chosen leaders to represent them, to be the bringer of information and provider of resources.
They are expert from the communities with lived experience that advocate for community members, making sure that community voices are heard. In the hospital, they serve as liaison between the community and the hospital, making sure that patient needs are addressed. We are addressing the social determinants of health, all social factors that may affect the health, and providing equal health to everyone, regardless of their background, social status, and race, and so on.
Personally, I'm from Somalia, so if I go to a Somali community, they will trust me more because I'm from them, so I'm able to help them with any resources that they may need.
So it was born out of the need I saw in the community, and I became a CHW not knowing that's what I was until years later. Again, this was back in 2000. And I could see that there are a lot of resources. We just need to find a way for the people that fall through the cracks to access those resources.
In different communities, for example, we have several events with the Pacific Islanders, American Indians, with the refugees, with the Hispanic community, Asian community. We have been able to do events at their own communities to try to bring them resources for their children to study health careers.
I think in community, no one's left behind. So, for example, we might be addressing social determinants of health through clothing or through health insurance eligibility, or answer those questions. Even if folks don't qualify, say if you're undocumented, the U has some resources like the wellness bus, the mammography bus, or other resources out there like school dentistry, for example, that you can get access to healthcare either at a cheaper cost or without insurance. So I think these community events that bring community together, and through education, I think we empower community.
When we started working with CHWs in the clinic, I think it just expanded the way that we were able to help patients. As medical students, we have all the training, well, not all, but we have training related to just healthcare and like direct health needs. But we didn't realize, I don't think, how many other gaps of care were falling through the cracks just because we didn't have access to those resources. So I think for me, it's just been cool to watch patients who come in for a healthcare need, get that healthcare need met, but then also are able to get some mental health resources, get food, get clothing, and just really get that holistic care that I just don't even think we realized that we were missing before we involved CHWs in it. It's just kind of emphasized the fact that it's a team sport, that like as a physician, when I'm like in practice later, not only like am I not able to provide everything that a patient needs on my own, but also like I don't have to. Like I've realized that there's so many organizations that are very accessible, a lot of resources in my own community that are very happy to help my patients and help me accomplish my goals, that like I don't have to try approaching patient care by myself. And so I think that's the biggest thing. I'm really excited, like wherever I end up practicing, to integrate like a lot of what I've learned like with CHWs, and just make sure that like when I have a patient that I'm really quick to find somebody else who can also help me meet their needs and make sure they're taken care of.
As a physician, it's humbling to know if you actually look at the outcomes, only 11% is attributed to medical care in terms of medical, like health outcomes. And so the rest of it comes from things in the community that people need: housing, food, access to like, you know, actual job that's going to pay something, the ability to set up a credit card to access things. For me, here in this setting, having a community health worker to connect to those things helps me leverage all of that 11% that I have control over to connect people to the other 75% of things that they need to be healthy. I would just say that like this is an imperative if we are going to say that we're working on health. This is what it needs to look like.
Thank you, Gabby. And thank you for requesting the video link. I did put that in the chat. So what we're really talking about is interprofessional collaboration and how we can utilize all of our skills and professions to support a community member through their healthcare. And as community health workers, we want to build the capacity of the individual to manage their own care, to be able to ask the right questions in an appointment, to be able to know who to speak to. A lot of times patients will ask the doctor about their bill, and doctors can't, and we are educating our future providers at the University of Utah to be able to direct those questions to the people that would fulfill those inquiries. Next slide, please. Thank you so much. That video was a part of a mini grant bestowed by the Utah Area Health Education Center. And area health education centers are nationwide, if you did not know already. Okay, so Jill had asked us to talk about best practices, and tailored education materials are super important. And I wanted to share this example because these prevention tips are an attempt to do that, provide tailored education. You'll see they have plain language and the photos. And then I'd love for my community health workers present to talk about how they might change this to represent their community or to use this in representing their community. So I, for one, in the Pacific Islander community, we would highlight the sugary drinks as soda or energy drinks so that they can directly connect to the concepts that are being shared here. Left on our own devices, sometimes when we're not familiar, we tend to not understand and have a lot of questions. So community health workers can help direct those questions to professionals. So I'd love for my community health workers to come off of mute if they have anything to add. Certainly language translation. What else might you advise about this tailored education material?
You know, when it comes to nutrition, a lot of providers will use the My Plate to share like what nutrition looks like and healthy foods. For me, what has been effective is using a Pacific Island My Plate that has the foods that they eat, or taking that concept and saying, what are the foods that are available in your home and how can we place them in the right place for this plate, to just help them to understand, you know, because cost is always like, or access to these certain kinds of food is always a barrier. And so helping to, you know, change that mindset for them when as they're learning, like, oh my gosh, I don't even eat that, or I can't afford that, or that's why I can't change my diet. Trying to eliminate those barriers in that way by looking at where they're at and providing substitutions that are better than what they're using has really helped for me in working with cancer patients.
Thank you, Areta. So when you're working in translation, it's always best to use a native speaker, someone who speaks the same language from the same country, because the dialects can be so different that words, even the smallest word, has a different meaning. So being able to work with native speakers is really important, especially in our communities from Myanmar. They speak rare languages that you couldn't find like on normal translation services. And then utilizing community health workers to engage community members in the development process. So, you know, how they want to receive this information, what could they do to make it more representative of their culture and community and understanding would be super important in tailored education materials. And at the University of Utah, I actually started out in research and sharing my scope and perspective as a patient, as a mother, as someone who has diabetes and high blood pressure. So having those focus groups and conversations would be very instrumental in getting the word out. And next slide, please, Gabby. And so what we're talking about is, this is a brainy quote for you. The ability to simplify means to eliminate the unnecessary so that necessary may speak. And because of the different learning styles and a cultural belief and nuances, a tailored message means that you'll have a different one for each community. Thank you. Next slide. All right, so tailored programs. We realize that these are things that you're probably already doing, but we wanted to speak to how community health workers can help you enhance your ability to do them. So conducting a needs assessment to identify gaps in care or understanding of the health topics of cancer and treatment and prevention might be very important in knowing what resources to bring to a community. You can partner with local organizations to form for program development, and community health workers can help you find those local organizations as well. Addressing barriers to care is super important, such as transportation and language and the time, right? If a person, so this image is actually a collaboration between Nevada and Utah's cancer institutes, and they were in Wendover, Utah, which serves Wendover, Utah, and Nevada. So they act as one community, and we have this reporter from Fox 13 interviewed a community member. She said, living out here in Wendover is tough when you need health care, especially if you are female. You have to drive all the way to Stansbury, and you'll go to the U or Salt Lake, wherever the doctor is. And that's about a 2-hour round trip drive. It's a great feeling to know that we're not forgotten, to know that there's somebody who cares and they're coming out here to take care of our community. So you see, it does make a difference. And when you're talking about a 2-hour round trip, I can speak for myself. I have a family of 6. I have 1.5 jobs, and I am on different community boards. So a 2-hour drive would be inconvenient for me, and I probably wouldn't do it right off. I would certainly delay treatment if that was a barrier. And so I'm sure for our community, it is the same. So offering those flexible program deliveries, even home visits and community workshops and virtual sessions would be very, enhance your ability to connect with community about health topics. And working with and training CHWs to provide personalized support and education would be helpful as well. Arita, do you have any talking points that you'd like to share on this slide?
Just wanted to add the importance of being flexible with what services offered. I mean, sometimes we can think that doing home visits or going out into community is, you know, it is a really good thing. But if you're not able to do it on an evening or, you know, on a weekend, it's kind of hard to go out because the community is working, and so they're not available in those times. So just finding out, depending on the communities, when the best times are, and being flexible in providing those services.
Thank you, Arita. And I want to introduce you to the person who gave this interview. Next slide, please, Gabby. Her name is Lucia Benitez Torres, and she is from Wendover. She's actually a community health worker who worked for the Tooele County Health Department during COVID. She along with her CHW team, provided a lot of the COVID clinics in the area. They gathered the partners to help. So she had facilitated a collaboration with the U.S. Army, and they had a drive-through vaccination, or excuse me, not vaccination, drive-through testing in the Enola Gay hangar. So we've been out to Wendover, Areta and I, to support Lucia, as the Tooele County Health Department has lost funding for CHWs, but Wendover has not lost the need for healthcare interventions. So we're supporting Lucia and to bringing more health services to her community. So she has disseminated the prevention messages. She built a collaboration with the local utility company to have inserts put into the bills for everyone in her community of how the CDC guidelines. She is educating her community about things like cancer risk factors and lifestyle changes. She herself promotes and facilitates the screenings for free. So she's making sure that everybody knows that those things are available. Like they just had a dental clinic last week. So she wanted to make sure that all of her community members know. She knows where to find them, she knows their families, and she knows their barriers. And so when you're utilizing a community health worker, they can do these things for you too. She actually can help guide patients through treatment and survivorship support. And she knows everybody out in the community who needs it and who might be able to support you in bringing those things to the community. And she is actually really connected to her local government. So when you're talking about advocating for policy changes to improve access to care, she can introduce you to the right people to do that. So here is another quote from a high desert advocate saying that Lucia was the person from Wendover to contact, that she was extremely helpful and many people got vaccinated because of her work. And there is also a link to the podcast that Areta and I interviewed Lucia, where she talks about their barriers to care and the health resources that they need. So you see, working with a community health worker can get you deeper into the community and provide a lot more access to the resources that are already there to enhance your work. Next slide. Thank you. So this represents the HPV vaccine, and hang on with me, because Jeanette Vialta was supposed to join us, but she can't. She participated in the 2 studies that you see on the bottom with Dr. Kepka. Dr. Kepka, are you on today? I'm not sure if she was able to join, but I'd love for her to speak. But we wanted to highlight the success of a CHW-led initiative in cancer prevention. And she has given me a list of the duties that they performed in this. So in 2018, we see that a little more than 30% of Utahns had the HPV vaccine, and they formed these studies. CHWs participated in the research team from the beginning, contributing their ideas on how to engage the community and what strategies to use. They also conducted focus groups and actually facilitated the conversations in language for the Hispanic and Latino community. They provided language interpretation and shared ways to make the HPV information less stigmatizing and raise awareness. And they conducted presentations in their communities and shared posters outreaching participation to outreach and gather participation for HPV vaccines. And the impact was that they were able to increase the vaccination rates. And if you'll hit the presentation, Gabby, I'll have another chart pop up. There we go. So by 2022, when this report was put out, you'll see the rise in HPV vaccinations. On these studies was a representative from the African American, American Indian, and Pacific Island communities, and also our white or Caucasian communities. And then one more click, Gabby. And you'll see the Hispanic community has the most, some of the highest HPV vaccinations through this work. And so one of the things that we wanted to highlight is how you can utilize CHW skills in your research and connecting with the communities to understand their belief systems, any cultural nuances that affect their education. And Areta, I'd love for you to share any insights you have here.
Yeah, no, I think we've gone over all of the ways that CHWs, again, I just want to emphasize that they're able to do this because of the trust that they've built with community members. And that trust comes from either representation or their lived experience, and also the education that they do get through their training that helps them to be effective in the focus groups and all of that. They're trained in group facilitation and doing surveys and all the different pieces of research.
Thank you. And at the same time in 2018, I actually had the opportunity to interview Dr. Kepka on our podcast, and it convinced me to get the vaccine for all of my children. And I was super grateful for the knowledge that she shared about the many cancers that the vaccination prevents. And next slide, Gabby. And Areta, if you'll take it away, we'll wrap it up. Thank you.
Yeah, so how can organizations better support CHWs? We are working on so many things, and it's just the whole health system, it's a complex system. And so there are different, multiple factors that play into the support that is needed for the work that we're doing. These are just some of the ways, the things that we're working on, but we really need your support in helping to advocate for these services, whether it's through helping us to bring the resources together or integrating our workforce into your research, like Kamali was talking about. And we want to encourage our partners and our allies to involve us from the very beginning. When you're thinking of designing a program, include the CHWs in those discussions, because there are a lot of things about the design of programs when you integrate CHWs into these programs that they can provide and contribute like key things in that design that will help programs be more effective. And then also in the publications, we are part of a lot of research. And prior to our advocacy for the CHW work, many of the research that was done, even though we had a lot to do with the actual focus groups and recruitment and facilitation, we are mentioned nowhere on the publications. And so we have asked the researchers if we could be listed as either contributors or authors or to those publications, to give credit for the work that we are doing in this partnership, in these partnerships. And then just providing mentorship. We have built different levels of CHW work, from our executive to supervisory to on the ground CHWs, and we've gotten a lot of support from the mentors in our specific programs who have mentored us, but also have helped provide opportunities for us to mentor the CHWs that come behind us. And so just all of these things really help to support our partnerships, as CHWs are not a new workforce, but this is like the introduction of our work being integrated into different professions. Your support and advocacy really helps people to give credibility to the work that we do. A lot of our work is done voluntarily, and it's 24/7. We don't have a clock in, clock out for this work. When the patients need us, that's when we're there. And so we appreciate all the support that our partners give us, but in doing these other things of engaging and integrating CHWs fully into your programs, that really helps to support the work that we do. And the Utah Community Health Worker Association is a association that helps to support the capacity building and professional development of CHWs. And we'd love to partner with you in any way that we can to either provide CHWs or recommend CHWs that are working specifically in your areas or in other areas, or just talk through how CHWs can fill the gaps in programs.
Thank you, Areta, and thank you, Jill. I realize we went way over our time, but we're
Sorry.
so grateful to be here. Thank you.
Oh, no, you guys are good. We have plenty of time. So thank you so much for all that information. That was really great. We appreciate you taking the time to be here. And I did just want to pause for a minute or two to see if anyone had any questions before we move on.
Hi, Kamili, Areta team. Thank you for this. It's so good to see you. My question is, could you speak to maybe some of the funding mechanisms and how your CHWs are funded, and maybe more broadly speaking, speak to the state of Utah, and do you feel that they're funding them in unique ways, or additional opportunities?
Thank you, Garrett. That's a great question. So my team operates under a HRSA grant, specifically for student education purposes, medical students. So we're covered under that tier, but our value has increased immensely in the MD program. So now the curriculum is taking over some of our funding. We do seek like foundational funding, charitable fundings, and federal funds when they're available. And even the mini grants opportunities from our local health departments. But it's important to know that community health workers are frontline public health workers. So any funding for public health staffing would be, would be the funding for community health workers. Areta, thank you. Great question.
Yes, also good. So traditionally funded through grants, and a lot of our diverse training comes from, the specific funding. So the cancer navigation grants, we're funding our cancer CHWs, diabetes, et cetera, et cetera. We have been there are Medicaid reimbursement codes that we've used in other states to reimburse for the work in the clinical area, and that's what we have been working on the past 10 years for Utah, because we have not been being reimbursed. Our peer support specialists who fall under the scope of CHWs do have certification, and they have Medicaid reimbursement. And so we followed suit with that. Given the political climate this year, we decided to just submit for appropriations ask, and that will be decided within, I think, the next 2 weeks. It looks pretty good. Senator Escamilla submitted appropriations request for, I think, $350,000 to support the CHW work. I sit on the One Health Collaborative team for the governor, and we have discussions every day about addressing like our just the high prevalence of chronic disease, ER utilization, all of the things. And in those discussions, we're talking about other innovative ways to support the CHW works as a part of your operational cost, because the value of and credibility of our work is now being recognized through studies we've done with the university and with the state through COVID. That we have so many partners and allies who are helping us to be more innovative of how we fund CHWs. But right now, Medicaid reimbursement is the path we're looking at, and then we continue to work on these grants.
Yeah, the David Eccles School of Business students did data collection on our workforce, and they determined that for every dollar you spend on a CHW, more than $1 goes back to the patient. And then we save costs in early discharge, less visits to the ER, and more prevention, and more education, and the building the capacity of patients to manage their own chronic conditions. So we save time and money and workforce energy. Thank you.
Thanks, Garrett. Are there any other questions? All right, well, we'll have some time at the end as well. So thank you so much again, Kamili, Areta. You're great. Thank you so much for taking the time. We can go ahead and go to the next slide, Gabby, and I will introduce our next presenter, Bethann Carter. She is the Assistant Director of Behavioral Health Workforce Programs at the Montana Office of Rural Health State AHEC. Since 2010, she has worked on healthcare workforce training in rural Montana, helping train nearly 7,000 people since 2017. As a champion for CHWs, she launched Montana's first CHW training in 2018, helped establish the Montana CHW Association in 2022, and manages the state's annual CHW Summit. She also oversaw the development of Pathway of a Messenger, Montana's first culturally competent CHW course for tribal communities. So I will turn it to Beth Ann.
Thank you, Jill. Hello, everyone. Yes, I'm Beth Ann Carter. We are located on campus at Montana State University in Bozeman, and I oversee all of our behavioral health related programs. Next slide, please. And so this is just kind of giving you a snapshot of kind of where we've come. We're community health workers are very new to Montana in the sense of as we had talked before, there's many names for them. We have community health representatives in our tribal communities. They've been around a long time. But as far as kind of having the training, the interest, the recognition, it's very new to our state. We received the Behavioral Health Workforce Education Training Program in 2017. And with that was a HRSA grant. With that grant, we created the state's first community health worker training. We rolled that out in 2018. And since then, we have had a number of mostly HRSA grants that have been training grants for community health workers with upskilling options, several different trainings that they can add. And then we also received the CDC grant that helped to deploy community health workers throughout our state. We've got 56 counties within our state, excuse me. And so one in each county, we were able to fund their salaries for 2 years with that grant. And so next slide, please. So since then, we've trained a little over 300 community health workers. There is now 2 community health worker trainings. We have our training, and then University of Montana also has a community health worker training. As I had said before, we had with the CDC grant that really helped to launch the momentum of community health workers throughout our state, being able to have sites that wouldn't have otherwise been able to fit them within their budget, being able to deploy them within their communities. And since then, that grant has ended, but they have been able to look within their budgets to continue to fund those positions because they've seen the return on investment. They've seen the work that they've done within their communities. And so they've really worked to continue with that. And within our state, organizations that have been employing community health workers, they're typically in the medical field, critical access hospitals, federally qualified health centers, CHCs, county health departments. But then we have some, and I thought it was really great that Kathy talked about how she works kind of through a church. And so we've seen kind of those other organizations like the Billings Chamber of Commerce is one that has a community health worker. And so it's very innovative to see how they're being utilized in the organizations that you wouldn't normally think would employ a community health worker, how they are and the success that they've had. Next slide, please. And so just some of the success stories that we've had in our state. Again, this is just within the last few years that we've been able really to kind of gauge. And we've got these organizations that are really starting to collect the data and to see the benefits of having these community health workers. We have St. Peter's Health in Helena. They have the Fuse program, and that supports homeless patients with their community health workers. They have 2 full-time community health workers and 44 clients. And so with their mobile crisis unit that their community health workers deploy, they've seen a 56% decrease in ambulance usage, 57% decrease in ER, 65% in inpatient, and urgent care has decreased 24%. And this was all over just one year with these clients that they had seen. And then also kind of looking at the criminal side, they saw decrease in 66% of their Helena Police Department calls, 89% decrease in incarcerated days. And they estimated that for that county detention center for that year, they saved approximately $49,640. And then savings overall to the healthcare organization was $158,400. And so that was just with those two community health workers in that 1 year span. The other program, Logan Health, they are located in Whitefish, Montana. They have a Food RX program that is run by one community health worker, and their patients are able to receive one box every week, all year long. And each patient within this cohort that this community health worker runs, it's part of their diabetes education and prevention center. 100% of their the Food RX participants lowered their A1C levels just within that program. And the next one, Messengers for Health. This is a program that an organization, excuse me, that is was started in 1996. The Crow Nation, which is the eastern side of our state, partnered with Montana State University, a faculty there, to invest in health equity on the reservation there. They really focused on cancer prevention. There's no Crow word for cancer, and so saying it out loud, they believe was asking it to come upon you. So nobody ever spoke about it. There was no talk about cancer screenings. When a woman did receive a cancer diagnosis, a lot of times this was, she dealt with it alone, and it was often kind of at the end of her life that she would share the diagnosis. And so the Messengers for Health started this program to where it was women within the community, which they called messengers, would deliver education and encourage the Crow women to receive cancer screenings and to partner with Indian Health Service to provide quality healthcare to their tribal members. And the impact within their community has been dramatic. Not only is cancer no longer a taboo word, they're seeing an uptick in the number of screenings per year, and how just as a community as a whole, the education that's being disseminated, people are talking about it. So it's just the cancer survivors are now speaking out in public and in support groups. And cervical cancer, which was once a very quiet, deadly epidemic among Crow women, is now openly discussed. And since then, they've taken on a number of other avenues to educate their community as well. So we've worked with them on a number of projects. We have our messengers, our pathway to a messenger curriculum, to where we took our community health worker curriculum and blended it with their Messengers for Health curriculum to create a culturally competent community health worker training, to which tribes throughout our state are able to take it and make it their own. It's very tailored right now to the Crow Nation and their culture, and other tribal organizations are able to take it and kind of hone it into their specific culture. Billings Clinic is another one that has been able to make great strides within their community. They have a community health worker that meets face-to-face with residents within their home. They built a lot of trust since the pandemic between health services and community members. They've seen a huge increase in the number of referrals, specifically in the Native American population, low-income residents, older adults over 65 years of age, and people with disabilities as well. They made over 200 referrals to services within 1 year to resources such as housing, food insecurity, access to healthcare, mental health and substance misuse program, income assistance, clothing, housing needs, and other government and legal services. And then lastly, as I said, we've seen a number of organizations that you wouldn't otherwise have thought how would they be able to employ and utilize a community health worker. So Billings Chamber of Commerce was able to, with the CDC funding, employed a community health worker that works with the business community, business leaders and business network groups, such as women in the workforce and young professionals groups. This community health worker has weaved community health worker training and education into all of their chamber programming. And after helping, they help to promote within their county, Yellowstone County, a community health needs assessment, to where the community health worker had initiated a strategy to help business leaders and employees learn about mental health, how to address mental health needs, and how to improve workplace culture around mental health. And so those are just kind of a few examples. As I said, we're seeing great strides within our state. We have an overall community health support workforce network that is really, and community health workers are the main focus, to where we're really wanting to support this workforce with looking at reimbursement options, sustainability, giving employers the tools and support they need to be able to ensure that their community health workers are successful. And that's it. Does anybody have any questions?
I just want to say thank you so much, Beth Ann. Those are pretty amazing examples of success stories and programs, and like hearing the impacts through the data collected is pretty amazing. So thank you for sharing.
I actually have a question, Beth Ann. Thank you for being here. You know, it's pretty interesting to think about like the business community and what you were sharing from Billings. Was there like an opportunity to like share best practices of how you were able to work with the chamber? I'm just thinking because there's chambers of commerce, right, in most cities, and it seems like an untapped opportunity, and maybe I'm just not as up to speed on it. But I'm just curious, like if you could talk through how that process came about and how you more or less not convinced, but how you worked and partnered with the business community, because we so often we think of business separate than public health in some ways. Thank you.
Absolutely. Yeah. I will try my best to answer this because this was part of the CDC grant. We received the overall state funding to where we were deploying community health workers training. And then there were 2 actual counties within our state, Yellowstone being one of them. Through Riverstone Health, they received funding to where they had 7 organizations that organizations throughout their county could apply for this program, to where they would get funding for a community health worker. And so they had to kind of come up with that business plan, logic model to how they were going to utilize them. And Billings Chamber of Commerce essentially came up with this idea, and for 2 years, really, I mean, honestly, they were kind of one of the superstars of the program, just in everything they did. And I can definitely get you in touch with Kathy over at the Billings Chamber of Commerce. She's their community health worker, and they've just had such an innovative approach. As I said, just really reaching out to those the businesses. And I think the big thing was really that community health needs assessment, and being able to see where they were at, what businesses were needing, and not just the community, but businesses, and seeing that it was that mental health piece, and how to really support businesses within their county to get them that education, to help them improve their workplace culture around mental health. So yeah, that was and it wouldn't have been possible without that grant.
Thank you, Areta. Go ahead.
Yeah, I was just going to share. So UGL works with a lot of community-based organizations, and many of our CBOs work with our chambers. The Pacific Island Knowledge to Action resource organization has an ecosystem that addresses holistic health and uses addresses social determinants of health, and have integrated their cultural practices with that, and looking at the needs from the needs assessment of economic stability, cultural connection, and then just resource connection. Their Chamber of Commerce, they have hired CHWs to do business education and business research. So they have chapter meetups every month where they're providing this education. They also provide financial literacy for our community members as well. So there's a lot of different innovative things that our community-based organizations have been doing in the state, very similar to what Beth and Anne has shared in Utah. So we have a lot of examples too of how we partnered with these organizations to do this work in different professional areas. In fact, we have now medical debt legal advocates who are CHWs. We now have a criminal justice advocate through Innovations for Justice that was just approved for housing. There's so many, there are different pathways for CHWs to work in these different professional areas, but their scope of practice all comes back to that connection and trust with the communities that are being served. And so, I mean, I love everything that you shared, Beth. We've heard a lot of great things on a national level, as I am on the board for NACHWA, about what Montana is doing in other states, but Utah has been doing a lot of these things as well. They just haven't been recognized, and it's taken Utah a little bit slower time to just understand how CHWs have been integrated into these different areas.
Thank you for sharing that, Areta. Gabby, if you want to go to the next slide. That wraps up our presentations. I just want to open it to see if anyone has any more questions for our presenters, if anyone has any comments or experiences they would like to share working with CHWs. We'd love to hear it.
I have a question for everyone. As you've listened today, where do you think community health workers can help you with your goals? Did you get any thoughts or ideas from what was presented today? I'd love to know. Thank you.
Well,
I'm
Kamali,
sure.
I
Yeah,
hate to
go
be the
ahead.
only one. I hate to be the only one speaking, but I'm just grateful because I feel like there's a lot of opportunity through, what Jill is going to talk about next, to think about how we can, build on some of this amazing momentum that is happening in all of the states. Wyoming didn't present today, Nevada didn't present today, or Idaho, but the work is happening there too. And so I think there's a lot of opportunities, to discuss kind of in this next segment of how we can think about, cancer prevention specifically, and screening and education, and really get, your ideas and I love that so many community health workers are on the call as well. So I just want to reiterate my gratitude for that.
Thank you, Garrett. And I wanted to address a question you probably have is, what makes community health workers different from social workers or nurses? Areta, you care to tackle that?
Sorry, can you repeat that, Kamila?
What makes us different from nurses or social workers?
Oh, I think again, I mentioned earlier that there's so much overlap, right? But it's just it's an extension of that work that we can do outside of the organizations, like in-house and out, versus going into community. And because we have that flexibility to do that, we can meet community members where they are and work on the things that, we have a lot more time to work on those things that may take a little bit more time for them to address than they have time in the provider's office. We understand the heavy administrative pieces that providers have when in the office exams rooms, having to collect quality data and input everything in the EHR and all of those things. And so we have the time to, as a part of the care teams, to provide that other information outside of clinic that can be helpful in preparing treatment plans and all of those things. And I just wanted to see something that was just mentioned, but the Regional Health Equity Council also has a CHW group where all of the states in our region are sharing what their CHWs are doing in their states. So if you'd like more information on that, you can also go there. Christine Espinel from the Office of Health Equity is one of the representatives there for Utah. So she's also a good resource.
Thank you so much, Areta, Kamali, Beth Ann. You all have been incredible in sharing this information. Gabby, if you want to go to the next slide. Garrett segued into this a little bit, but I did just want to announce that we are in the process of creating a CHW ad hoc group as part of this Mountain West Cancer Collaborative. So this group will be co-led by myself and Kamali Tripp-Harris, who you heard from today. This will be a collaborative space to share resources, exchange knowledge, and discuss best practices. It will also provide opportunities for brainstorming, networking, learning from each other, and just fostering collaboration to strengthen the CHW work throughout the region. So if you are interested in joining this group, please scan the QR code on the slide, or I also have a link here in the chat that you can fill out the form. We would love for you to join. We're really excited to get this group off the ground, and especially after hearing all the amazing projects and things that CHWs can do today. We're very excited. So we can also send these links out afterwards if you're interested in joining. And finally, I did also just want to give a little plug to our Cancer 101 training that we are creating. It will be a free online resource for CHWs that we are working on in collaboration with the Utah Community Health Worker Association. This training was adapted from an existing training that Fred Hutch created. So we are excited to be able to implement this into the Utah CHW state certification in the coming months. And we also do want to make it available for all states in the area we serve by fall 2025. So we will definitely be sharing that resource with you when it's ready. And if you want more information, you can reach out to me, or you can join the CHW ad hoc group that we are forming. Okay, next slide, please, Gabby. And finally, if you all wouldn't mind, please filling out this very short survey for the webinar evaluation. We really appreciate your feedback and input, and I want to make sure that these webinars are useful for everyone and relevant. So I could just stay on this slide for a moment, give people a chance to scan that. And I'll put it in the chat as well. Okay, go to the next slide, Gabby. All right, well, that was all the content we have for today. Thank you all so much for joining us and for your engagement on this topic. A special thank you to our presenters, Areta, Kamali, and Beth Ann. Thank you so much for sharing your expertise and insights. It was super helpful. And we hope you leave today with some new inspiration and ideas of how to continue this work in your communities. So yeah, thanks again, and I hope everyone has a great rest of the week. Thanks so much.